If you want to lower your risk for developing the most dangerous cancer in the world, then this is the video you want to watch until the end. Cancer of the pancreas, pancreatic cancer, just the mere mention of it makes people's heart rate go up, and it should. It is by far the most dangerous cancer in the world. It has the lowest survival rate of any cancer known to mankind. Once diagnosed with pancreatic cancer, you have a 3 to 5% chance of being alive in 5 years. The survival rate for most other cancers has went up as treatments improve, but not for pancreatic cancer. If you're diagnosed, you're pretty much screwed. A lot of people will say that early diagnosis is the key to successful treatment of pancreatic cancer, but I think probably you're interested in what I consider the most important key, the primary key, and that is to prevent pancreatic cancer from ever happening to you or someone that you love. There's a new research study I'm going to talk about in this video that makes it very clear that there is something that you can start doing today to lower your risk of ever developing pancreatic cancer. Being diagnosed with pancreatic cancer is such a death sentence that most researchers don't really want to study it because there doesn't look like there's any room for treatments or therapies that could actually have a life extension benefit once you've been diagnosed. But this new study makes it very clear that by changing one key variable, you can slash your risk of ever developing pancreatic cancer. By the time most pancreatic cancer is actually diagnosed by a doctor, it's too late. You've got 4 to 6 months to live. And so early detection is important, but preventing it, that's the home run that you're looking for. Now, for the past several years, I've had a hypothesis, along with other doctors and researchers, that hyperinsulinemia increases your risk of developing pancreatic cancer. And this new study, here's the title page of this new study, and I'm going to put a link down in the show notes so you can look this study up yourself, shows a direct link between having insulin levels in your blood that are just too high is directly related to your risk of developing pancreatic cancer. They actually put the hypothesis that hyperinsulinemia, chronically high insulin levels, actually increases your risk. They put that hypothesis to the test in this study, and this study showed without doubt absolutely hyperinsulinemia plays a huge role in your development of pancreatic cancer. So while looking at this graphic of a blow up of a beta cell inside of your pancreas, the beta cell makes insulin. And so when you're eating a diet that's too high in carbohydrates, that causes your insulin level to spike up really high. And when you're eating 3 meals a day with snacks in between that are all high in carbohydrates, that's going to give you hyperinsulinemia. And in this study they found, it says our data clearly support a model in which insulin receptors in acinar cells play a causal role in supporting cancer initiation in the context of diet-induced hyperinsulinemia. And one of the other things that hyperinsulinemia leads to is obesity. The contribution of direct insulin action on acinar cells during initiation from normal cells explains a large portion of the cancer accelerating effects of hyperinsulinemia. So anyone who's worried about developing pancreatic cancer, and that should be all of us eating a standard Western diet, a standard American diet, your question is, okay, what do I need to do? What test do I need to have checked? So the test you need to have checked is a fasting insulin test. Now, for those of you who are injecting insulin, either for treatment of type 2 diabetes or for type 1 diabetes, you need to have a C-peptide checked. That's a proxy marker for how much insulin that your pancreas is actually producing minute by minute. With that information, you can know immediately if you have hyperinsulinemia or not. And so here's a LabCorp sample result. And you can see that they say that any fasting insulin level up to 25 is considered normal. And I disagree with that very, very much. Along with me, multiple other people in the healthcare space disagree with this. Professor Ben Bickman, Mark Hyman, many other people say no. Even if it's above 10, that's too high. If it's above 10, that's hyperinsulinemic. And you have to remember this LabCorp sample test, the way they got this normal range was they took 200 or 300 people who are eating just the regular diet and they checked their fasting insulin level. And so if somebody's eating too many carbohydrates, their fasting insulin level is going to be much higher than it would be if they were eating a lower carb, proper human diet. So you're going to ask your doctor the very next time they draw blood to check your fasting insulin level. And if that level is above 10, you're at increased risk of developing pancreatic cancer. And then your next question should be, okay, I got my fasting insulin results back. It's above 10. How am I going to fix that? The way you fix that is by eating a very low carbohydrate diet. It can be a ketogenic diet, a keto diet. It can be a ketovore diet, or it can be a carnivore diet. Any of these ways of eating is going to get your fasting insulin level back down to normal levels and erase that huge risk factor for developing pancreatic cancer. So if you're not familiar with these ways of eating, keto, ketovore, carnivore, I've got hundreds of videos on my YouTube channel that explain how to eat these very healthy, ancestrally appropriate diets. So the key concept you need to walk away with is, okay, do I have hyperinsulinemia? You ask your doctor for a fasting insulin level or for a C-peptide level. And if your doctor gives you any kind of kickback about that, say, well, doc, there's a new research study. I printed you out a copy. Here you go. That shows that hyperinsulinemia is a direct risk factor for developing pancreatic cancer. And my uncle, my dad, my grandmother had pancreatic cancer, and I don't want to develop it because it's a horrible way to die. It's also a very fast way to die. So could you please check my fasting insulin level or C-peptide? The way you think about this is, if you're eating a diet that's too high in carbohydrates on a daily basis, on a meal-by-meal basis, that's going to give you hyperinsulinemia. And if you keep hyperinsulinemia long enough, high enough, it is going to greatly increase your risk of developing pancreatic cancer. You've probably seen some news stories lately about pancreatic cancer is going to become the leading cause of cancer death by 2030. Yep, that's right, if we don't do something about it. You may have seen a celebrity or two who's been diagnosed and died of pancreatic cancer over the last few years. What I want more than anything for you is for you not to become one of these statistics. I want you to prevent pancreatic cancer before it ever begins in your pancreas. And the way you do that is by eating a diet that keeps your fasting insulin level under 10 for the majority of your day, of your week, of your month, of the rest of your life. And those ways of eating are inherently, by definition, very low in carbohydrates. Now, if you don't know anything about diet, keto, ketovore, carnivore, low carb, I don't know about any of that, I've included a link to my free Proper Human Diet guidebook. It's right down in the show notes. You can click on that and I'll email you a free copy of the Proper Human Diet guidebook. And it is, by definition, very, very low in carbohydrates, and it's going to reduce your risk of developing pancreatic cancer. So check that out. I also put a link to my Keto 101 playlist. If you think a diet of meat and veg, that sounds delicious, that's going to lower your risk of pancreatic cancer. If you be happy eating meat and eggs for the rest of your days, then check out my Carnivore 101 playlist, because that's going to teach you how to do carnivore right. Hope this video helps. Links are in the show notes. This is Dr. Barry. I'll see you next time.